I love hearing from folks who catch my programs via the 25 stations that carry us. So I was really thrilled when you contacted me about your video for the Healthcare Blues. So I'm pleased to add a listener from KZGM in Kabul, Missouri to our Heartland Potluck. Perhaps you can take a couple minutes to introduce yourself, your music, and your activism to all the folks gathered here tonight.
Oh, thanks, Mark. It's so good to be here with y'all. Y'all look so nice. What a group. I want to tell you a story about my song and about community radio. I worked a booth at a local festival for a group called Missouri Healthcare for All. I had cards to hand out that said, "Tell us your story about healthcare." My friend Linda wanted to tell me her story. Linda ran our 7-county solid waste district for almost 20 years. Her legacy is in megatons of trash. My community is a cleaner and healthier place because of what she got done. But then she lost her job and she couldn't afford her health insurance. She was able to get coverage through the new Affordable Care Act marketplace. 1 month later, she found out she had terminal cancer. Surpassing all expectations, she lived at home for about 18 months. During most of that time, her quality of life was pretty good. But home hospice care was a huge blessing to her and her husband. Eventually, she died at home with her family, and afterwards her family was able to pick up the pieces without being in financial ruin. I recorded her story and discovered that I had a fantastic 45-minute interview. I thought, people need to hear this. I wondered if my local community station, KZGM, would play this show, and they did. I had also been working on a song about the health care coverage gap here in Missouri that 18 other states have as well, and Wisconsin is one of those states. The Affordable Care Act helps people down to 138% of the poverty level to purchase health insurance. Below that level, federal money was to be supplied to all the states to raise their health safety nets so that all our low-income people would get help. But then in a 5-4 decision, the Supreme Court ruled that states could opt out of expanding their programs. This left our poorest folks, many of whom work, with no health care. In Missouri, it's almost impossible for folks to get Medicaid coverage. Try raising a child on a family income of less than $300 a month. Well, anyway, I ended up recording the Healthcare Blues and added it to Linda's show. Some of my friends encouraged me to make a video. Lucky for me, I had some friends that have a small video company, Somewhere in the Woods Productions. They gave lovingly of their time to help me get this done. I also got help from many other good friends. When it was done, Mark was one of the first folks I thought of contacting. I've gotten a lot of inspiration from Spirit in Action and also from Song of the Soul. And Mark takes me around the world and he introduces me to amazing folks. And on my bad days, this helps me to remember, I am not alone. We are not alone. You know, some days I feel totally overwhelmed by all the causes and needs and pain that this world has. So it was really nice for me to find an issue that had a solution that seemed very simple and clear. And I thought, just maybe, I could take a bite out of that problem. And if a solution can have some laughter or a little fun with it, hey, all the better. We have a powerful radio community. We can reach out to each other. We can even participate. We inspire each other. To keep this happening, we need to support community radio. And Mark and other hosts need to hear from us. I know Mark's clear, kind voice so well, but he never heard my voice until after I wrote him. I am so happy you are all here celebrating Northern Spirit Radio. I want to keep it coming to the Ozarks so I can live in the middle of nowhere and still know what's going on and what I might do about it. Thank you all so very much, and I hope you enjoy the Healthcare Blues. I went down to the kitchen to get myself a drink. I tripped on the couch, hit my head on the sink. My world was really spinning, there was a ringing in my head. They took me to the doctor, this is what she said.
Keep up your endurance, and I'll give you my assurance. I'd really like to help you, but you ain't got insurance. Keep up your endurance, and I'll give you my assurance. I'd really like to help you, but you ain't got insurance.
I got the healthcare blues. I can't afford to pay my dues. I got the healthcare blues. I can't afford to pay my dues. I'm sick of this crap. I'm falling into the coverage gap. Wages are low, cost of living is high. I'm working 2 jobs, but I'm still not getting by. The bills keep a-coming and they have to be paid.
Let's see. Kids, food, rent, car, prescription drugs, college debt, interest or taxes?
Any way you do it, there's really nothing to it. You just do your best and hope that you'll get through it. Hey, is that a foreclosure sign on my house? I got the healthcare blues. I can't afford to pay my dues. No, 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 no. I got the healthcare blues. I can't afford to pay my dues. I'm sick of this crap. I'm falling into the coverage gap. Obama tried to help me, and my governor too. But the Missouri legislature, they wouldn't let it through. 300,000 people without any relief. But heal the sick, now that's a Christian belief. To all of those people, here is a trick. You don't need insurance if you don't get sick. Ow, that must have hurt.
Do you think he's gonna be alright?
I don't think so.
It was just an accident.
That's why they call them accidents.
Do you guys have insurance?
Ah, yeah, we've got blanket coverage. Hey, someone get a blanket over here. We need to get this guy covered up.
I got the healthcare blues. I can't afford to pay my dues. I got the healthcare blues.
I can't afford to pay my dues.
To all of those people, here is the trick. You don't need insurance if you don't get sick. Stay well.
Be healthy.
I got the healthcare blues. I can't afford to pay my dues. I'm sick of this crap. I'm falling into the coverage gap.